defective calcification of the bone matrix in children due to the calcium or phosphate deficiency caused by lack of vitamin D. Some of the causes are inadequate intake of provitamins and inadequate exposure to the sun, sometimes kidney failure or liver failure or congenital hypophosphatemia, that is congenital reduced uptake of phosphate by the renal tubules, can lead to rickets. Some of the clinical features are there can be weakness and bowing of weight bearing bones, there can be thickening of the wrist and ankles, there will be retarded growth and shortness of stature, there will be dental defects, hypocalcemia, hypotonia, ricketic rosary, that is beading of costochondral junctions of the ribs, are characteristic features. In prolonged cases, usually signs of tetany also develop. Usually the treatment is done by supplying adequate amounts of calcium and phosphates in the diet and administration of vitamin D. Osteomalacia. Osteomalacia is the adult counterpart of rickets. Adults seldom have a dietary deficiency of vitamin D or a calcium because large quantities of calcium are not needed for bone growth as in case of children. Some of the causes for osteomalacia are steatorrhea, that is failure to reabsorb fat, so that vitamin D, which is a fat soluble, is not reabsorbed or absorbed. Or it can be because of congenital hypophosphatemia. Usually the complications of tetany are not seen in adults. Vitamin D resistant rickets, rickets due to the congenital hypophosphatemia, that is congenital reduced reabsorption of phosphates by renal tubules, must be treated with phosphate compounds instead of calcium and vitamin D. Renal rickets, it's a type of osteomalacia that results from prolonged kidney damage. The cause of this condition is mainly failure of the damaged kidneys to form 1,25-dihydroxycholecalciferol. Osteoporosis is nothing but decreased bone matrix, and usually it occurs in old age. Some of the causes for osteoporosis are lack of physical stress on the bones, malnutrition, lack of vitamin C, which is essential for secretion of intracellular substances, and lack of estrogen secretion. Estrogen decrease the number and activity of osteoclast. The old age Cushing syndrome, here the osteoblastic activity as well as deposition of protein in the bone is reduced. All these factors, they are going to lead to